feeling, well, for some of us, that is actually, feeling good comes from exactly how we look, not only on the inside, but also on the outside. And over time, when you're dealing with age, sun damage, or the environment, and how we live can actually change a person's appearance. But making your skin look and feel like new again doesn't have to involve invasive treatments, all thanks to Sacramento Surgical Arts. Sacramento Surgical Arts specializes in cosmetic, facial, and oral surgery and can help achieve that youthful, beautiful glow with innovative procedures. Here to explain more about their procedures, including the benefits of chemical peels, is Dr. Heir of Sacramento Surgical Arts. Always good to see you.
Hi, nice to see you.
So let's talk about chemical peels. Why would someone get one? What are the benefits?
Well, as we go through life, from the time that a baby is born till the time they're older, the aging process continues. Aging process in the 20s can be affected by sun, so UVA and UVB lights. As we get into our 30s and 40s, we start getting fine lines and wrinkles, some melasma from pregnancy and things like that.
Yes.
So all those are reasons to get chemical peels if one elects to do them, because what it does is it harmonizes the skin, it restores a balance to it, it produces more collagen and healthier collagen. And it all starts with basics, you know, good skincare treatment lines. What I found is stuff that you buy from a store, albeit that it's expensive, it's not really controlled and it's not really tested by doctors. So there are certain lines that you can only get in doctors' offices. And all those products have certain chemicals in them, whether they're retin A, which helps turn over collagen.
And I've heard of that before, yeah.
Whether it is something that controls skin pigmentation. We all have different skin pigmentation. The ones that are in the classes of 3, 4, 5, and 6, the darker toned, are protected by some effects of the internal pigment from sun damage. And that's why people of African descent or Indian descent may not look as old in their mid-years compared to someone who's a Fitzpatrick type 1 or 2, where they get hit with a lot of sun. So what the chemical peels do is they balance everything out, and you can go from a superficial peel that you get at spas.
Yeah, well, what's the difference? What's the difference between getting something that you get at a spa, like a facial peel there, and a chemical peel from a physician?
A facial peel at a spa, you walk in and they put some glycolic acid on you, and what it does is it basically takes off the very superficial layer, so there's no peeling involved, there's no redness involved. There's a little bit of stinging, but it's not, it's more of...
so it's working on the top?
It's just working on the top.
Okay.
You can get rid of blackheads with that. Okay. Then the next level, which spas are not allowed to do unless they have a physician on board who's licensed to do it, is TCA peels and phenol peels and Gessner peels. And those are the deeper layers. Our skin has 4 or 5 layers, and the glycolic peel just gets at the epidermis, which is the skin that sloughs off every 28 days. Every 28 days we get new skin formation. Then you have the TCA peels, which go into the deeper dermis, and we call it the reticular and papillary dermis, and depending on what concentration of product you use, you go deeper.
And I imagine, too, that probably gets rid of the layers then that have that damage, right?
Correct.
All the exposure, maybe the irregular pigmentation and all that damage from the sun, hence the benefit. And then you also have some great products here, though, too, that I imagine probably work really well with a chemical peel to make sure you maintain that healthy look, right?
Well, what happens is when you go in to have a chemical peel or even a laser peel, by doing the peel afterwards, your skin can react, and it can get hyperpigmented or hypopigmented. So it can get darker than what your natural color is or lighter than what your natural color is. And that may not be a problem unless it's not blended properly. So the cells that create pigment are called melanin cells or melanosomes. And what some of these products do is they tell them to, okay, calm down. And it balances them out.
So this is a proper care you need to make sure that everything's working together and you're going to get the result that you want. Okay.
And you start, 28 days, and usually I do a couple cycles of these, and then we do the chemical peel. And also protecting yourself from sunlight before and after is probably the biggest thing.
Yes, because you want to maintain that. If you're going to do that, why would you damage what you
you're
just
gonna
tried to correct.
exactly, you're investing a lot of time, energy,
Yeah.
effort, and money into it,
Yeah.
and then if you go out without sun protection, you know, you're recreating the problem.
Yeah, the problem that you just tried to erase.
Exactly.
So how do people reach you and find out more about your clinic?
The best way is go to our website or call the office and speak to Gina. She's our cosmetic coordinator, and they'll get you in and have you see me.
And get you on the way,
Yeah,
and make sure you get the right treatment and the right products, and feeling and looking more youthful from the very first treatment, I imagine.
Definitely.
Excellent. Thank you so much. Always good to see you.
Same here.
And you know so much. I love it because you explained so well exactly what you